My name is Morgan Harris. I'm a physical therapist in outpatient physical therapy at Greenwich Hospital. I work right above us on the 3rd floor. My team will be seeing you before and after your surgeries. So today I'm going to discuss the role of rehabilitation if you choose to have a total joint replacement. So regardless of particular medical diagnosis, most people choose physical therapy for a handful of the same reasons. Increased pain, decrease of quality of life, and the frustration that goes along with that. Functional and physical barriers to employment, recreational activities, and socializing. An inability to drive the car. And get around town. Falls or near falls, as Dr. Kavanaugh spoke of, from buckling. Or new joint pain from compensatory postures. If you choose to have a total joint replacement, some patients may pursue outpatient physical therapy first. The goal in outpatient physical therapy in this stage is to improve the range of motion at the ankle, knee, and hip or shoulder itself in order to restore proper alignment. In addition, we want to increase the strength of the joints above and below the point of pain in order to decrease joint compression and pain. Post-operatively, we will be seeing you daily, which is a physician and a universal protocol. We will be reviewing surgical precautions and contraindications in order to maintain the integrity of the surgical site. So, if you've had the surgery, we're going to be seeing you day 1. We're going to initiate bed exercises. Tori just talked about this a little bit. We do this to prevent secondary complications like pneumonia and blood clots, improve circulation, improve resting blood pressure, and to prime the body for movement. We will then use as much or as little help as you need to get you to the edge of the bed. And our primary goal for day 1 is to get you out of the bed and into a chair for lung health. On your last day of discharge, you're probably going to be walking in the hallway. And if this is a shoulder operation, this is a given. However, if you're a hip and a knee, you'll be surprised to know that you'll be walking with a walker almost independently, sometimes without even a PT, but always supervised. You'll note that you have an easier time with bed mobility, transfers, toileting, and self-care. And independence is a reasonable goal depending on your surgery and how you're doing. So one of the most frequently asked questions to all people in the hospital is, will I be going home? This is a multifactorial question. It's going to depend on many variables. Do you live alone? Do you have a lot of physical barriers in the home? Are you the primary caregiver for a dependent person? Also, your ability at the time. How sick did you come in will likely affect how you're doing several days later. Whether you go home or not, note that we're required to provide you with a safe discharge plan. And that will be determined by your physician, your physical therapist, your case manager, and insurance. Please note, though, that we're there for you at all stages, that we're going to be asking a lot of you when you're not feeling great, whether it's before the surgery or afterwards. But maximum results are improved when you give us maximum effort.